podcast. Today's discussion is going to be about the pharmaceutical industry and how much of its campaigns are dedicated to actually keeping you sick, in which they can treat you with some kind of medication and keep you in a systematic process of coming in and out of different types of treatments. Do you have trouble keeping your legs still? Do you have an issue with fidgeting? Do you feel nervous in public? Do you have a problem speaking in public? Well, ask your doctor about pill X, Y, and Z. Are you having trouble sleeping? Take an ambient. As ridiculous as that sounded, most of you have probably been bombarded with those kind of images via commercials, or you've been advertised in that way by Pharma. Pharma will literally create a disease, a disorder that can be manufactured or advertised, and then they'll spend aggressive lobbying trying to convince you that this is a legitimate, actual problem. And, to be fair, there are some pharmaceutical drugs that do some amazing things, but it's far and few between when you look at how over-medicated and how sick the American population actually is. So like I said, Pharma will create a disease, a disorder that can be manufactured via advertising or aggressive lobbying. Then they'll hire a PR firm and a whole bunch of biased doctors to go on CNN and MSNBC and Fox and promote the new disease and disorder. But the reality is, many times, this ailment or whatever the problem can be fixed through nutrition or a exercise regimen. And I'm not saying all of, these issues are, but a lot of the times they relate back to your overall health and physiology. So for example, sleep issues and insomnia, which is very popular in the United States, is typically associated with magnesium deficiency. And I have a whole video about the importance of magnesium, but you need to understand you will not be able to sleep well if you are deficient in magnesium. And obviously exercise also helps, but the majority of people who have trouble sleeping are deficient in magnesium. Now think about this. If you were to tell your average American MD, if you're lucky enough to regularly see a doctor, that you can't sleep, say you go up to your doctor, you say you can't sleep, they will more than likely not even mention magnesium, let alone give you a blood panel. And how about depression? It's a very taboo subject, but depression is often treated with antidepressants that have shown to be no more effective than placebo sugar pills. Now, that's the case for Prozac. Prozac was demanded, the company Prozac obviously, was forced to hand over documents related to Prozac. And in the internal documents, attorneys found that Prozac is no more effective than a sugar pill. And just think about the millions of people that were prescribed that. Now, again, I'm not an expert on depression, but there are numerous reasons one can be depressed. However, a great deal of the time it's related to nutrition and physical activity and your overall hormones. That is why it is vital to get a blood test. And I guarantee your doctor will never do this type of work and will most likely give you a prescription. Now, I'm not saying your doctor won't give you a blood test, but they're going to try and save the hospital money, and they're going to probably try not to have you get a blood panel, so they'll probably give you some kind of prescription. Now, let me remind you, if your gut biome is thrown off, which happens to be, how important it is, it's 80% of your immune system, it's almost a guarantee you will feel depressed if your gut biome is thrown off. And depression can also be from, being overworked, being at an unfulfilling job. The point is, there's a million different reasons one can be depressed, and we need to be looking physiologically first before giving people medicines. Now, I'm not saying that people shouldn't take antidepressants, and I'm not a doctor, but I am telling you that you should exhaust other options. Now, let's think about something a little more sinister. OxyContin. I'm sure that name just rings unfortunate turmoil. It was prescribed as a fast-action solution for pain, working 12 hours, which is double the time of the normal over-the-counter like Tylenol, and it was marketed as one pill for 12-hour relief. No need to take a whole bunch of pills. However, this pill, as you know, was virtually identical to heroin. It was extremely addictive and was prescribed for all kinds of issues that it was never intended to be prescribed for. Insomnia, headaches, anxiety, PMS, anxiety issues. It was handed out like candy, and based off of quote unquote the company's clinical research, it was efficacious and it should have been prescribed in that way. Purdue Pharma paid for PR campaigns, I'm sure you guys remember, Partners in Pain. They created a psychological ad campaign highlighting how chronic pain can never be proven and how your doctor must always honor you and listen to you when you say you're in pain. It was a famous commercial. Partners in Pain. The fast-acting solution in OxyContin was amplified when you crushed it or snorted it or injected it, which then created a cascade of overdoses. But this wasn't even the worst part. As soon as the patient's prescription was over, that's when heroin demand skyrocketed in the streets because they no longer could get their legally prescribed, I want to say heroin, let's just call it OxyContin. And this is why you see the opioid crisis that has ravaged this whole nation. There's not a single neighborhood in the United States that does not have, a family member or someone who is impacted by it. And the worst part is there's numerous alternatives to OxyContin. And yes, I know some of you pill-obsessed people are going to talk about how opioids do kill pain, which is true. I'm not saying it doesn't, but there's a very fine line and how addictive it is. There are so many alternatives that you can use in combination that can give you the same or much better pain relief, like Rick Simpson oil, CBD, combination of all the three. And the worst part about all of this is the companies knew about the addictiveness and how it should have never been prescribed, but they spent so much time and money to convince people that that's the case. So I'm not sitting here telling you to not listen to your doctor. What I'm telling you to do is exhaust all of your options before turning to some kind of a pill, which has likely been just rushed through and approved by the FDA because of their cozy partnership with Pharma. So for example, if you're diagnosed with having some kind of depression, before you jump to taking pills, look at your diet, look at your blood work, look at some possible things that you could rule out before just popping pills. And if all options are exhausted, then maybe you can, talk to your doctor. But I just want to remind you to really look within yourself and assess yourself in many different ways before doing these type of things. And I hope you guys just got some value out of that. It was just a reminder about pharma and how it manufactures sickness. We don't have a healthcare system, we have a sick care system. So I hope this gave you value. There's going to be more content, more topics. Much appreciated. Much love.